Hey guys, today we're going to talk about some awesome research and why every single person today should have their spine evaluated for the condition called subluxation. You don't want to miss this. Hey guys, Dr. Kleiman back, and today we're talking about an absolute life-changing message that we all need to hear. This is a top tip on why every single person we know needs to get checked for subluxation. So I'm going to actually give you the research as to why it's important to get checked, to have your spine checked for subluxation. So guys, you're very aware, most of you are aware of the condition called subluxation, where the spine shifts out of place, puts pressure on a nerve, creates lack of function to whatever that nerve controls in the body, and creates dis-ease or dysfunction in the body. That's called the compression model of subluxation. Pretty self-explanatory. However, research today is showing that the compression model of subluxation isn't actually as impactful to the function of the nervous system as a model of subluxation called the disafferentation model of subluxation. So guys, follow along here. So in the body, there's something called mechanoreceptors. Mechanoreceptors are like proprioceptors. They're sensors, they're all over the body, but 90+% of them are located tucked in right along the spine. They're in the small ligaments, small muscles, joint capsules, discs, and they send, according to Campbell and Schwartz neurology text, they send 80 to 90% of all messages into our brain to monitor movement of the spine. Guys, when we have subluxation, what happens is it affects the movement of that joint segment, so it doesn't move properly. That then sends an aberrant message from the mechanoreceptor into the spinal cord, into the brain, increasing sympathetic tone, increasing the release of norepinephrine, and significantly contributing to disease processes in the body. So follow along the chart here. So again, we have aberrant movement from subluxation, which sends an aberrant message into the spinal cord. If you cut your spinal cord, it's like a butterfly in here. There's 10 layers. Anatomically, according to Netter's Neuroscience 2010, the mechanoreceptors connect directly to layer 7. Layer 7 goes into your brain, specifically to the sympathetic chain ganglion. That's what causes the release of norepinephrine, and the adrenals affect epinephrine, or noradrenaline and adrenaline. So again, guys, subluxation, lack of movement, aberrant message into the cord, aberrant message into the brain, into the sympathetic chain ganglion, increases sympathetic tone, and that significantly affects your immune system, your blood pressure, all your organs, your discs, your muscle spindles. And according to research, an increase in norepinephrine has been linked to cancer, diabetes 1, diabetes 2, osteoarthritis, rheumatoid arthritis, glaucoma, hypertension, and immune system problems. So guys, increase in sympathetic tone is bad, and subluxation contributes to an increase in sympathetic tone. And this is the thing, guys, you don't feel it, you don't see it, you don't smell it, you don't hear it, and we are trained to base health on how we feel. This is why we want to be checked for subluxation independent of how we feel, and this is why, one of the main reasons why I created Spinal Hygiene Community, because we have to create an awareness of why it's so paramount we have the spine checked. So hey guys, that's a little bit of the research, and I'll give you one last article. This is actually from 2007 from the Journal of Clinical Neurophysiology. So they actually did a study where they took a control group and a study group. And in the control group, they took the patient through an adjustment to monitor brain activity, but they didn't make an adjustment. They took them through the motions of the adjustment, but no adjustment. There was no change in brain activity. The second group, they hooked up to a monitor to monitor brain activity. They actually made an adjustment, and guys, get this. Research shows the adjustment decreased sympathetic tone and decreased sympathetic tone in 5 minutes. A lot of these studies are being done, guys, because they're trying to create a drug to decrease norepinephrine. What I'm telling you is we can decrease sympathetic tone, we can decrease norepinephrine in 5 minutes with an adjustment, without medications, and it's cost effective. It's the most helpful thing, and it's paramount that we get this message out to people. So guys, this is called the disafferentation model of subluxation, why I encourage everyone to be checked for subluxation or movement in the spine. There's a definite connection between how the back functions and the brain functions. So it's not just about bone on nerve, guys, it's about how the back literally affects the function of the brain. So hey guys, that's your tip of the week, and we look forward to seeing you again soon.